Hello, I'm Peter Ndora. Welcome to this week's edition of Health Talk. Now, today is day 125 of South Africa's national lockdown and day 59 at level 3 in response to the COVID-19 global pandemic. So what's coming up on the program today? Well, we'll be joined by a medical coordinator, TB, HIV integration and viral hepatitis at the National Department of Health. To speak to us about what hepatitis is, the causes, symptoms and prevention. This, as World Hepatitis Day was observed on July the 28th. We'll also speak to the head of the liver clinic at Groote Hospital about who's at risk of contracting hepatitis, the diagnosis, treatment and availability of the vaccine and the impact of COVID-19 on a person who has hepatitis. We'll also speak to a sports physician about how exercise may affect the immune system against COVID-19 in particular. And also on the program, we'll be speaking to a clinical psychologist about post-traumatic stress disorder, PTSD, it's otherwise known as, and how to cope during COVID-19. All of that is still to come, but first, our senior producer, Zama Buthelezi, takes us through the latest South African COVID-19 numbers. A very good morning to you, Zama. Give us the update.
A very good morning to you, Peter, and our Health Talk viewers. COVID numbers continue to rise, and South Africa is now 5th in the world when it comes to COVID-19 infections. Let's look at where we are. Countries leading with the highest numbers, we see United States of America, where more than 4 million positive cases have been recorded. Brazil following at more than 4.2 million positive cases, and India more than 1.4 million positive cases reported so far. As the country prepares for the peak of COVID-19, we continue to see a rise in numbers. Let's take a look at the national statistics. So far, more than 2.8 million tests have been conducted, more than 450,000 positive cases recorded, more than 280,000 people have recovered from the virus, but more than 7,000 people have since passed on in South Africa. Taking a look at the provincial statistics, 4 provinces with the big metros continue to record the highest numbers of infections. The epicenter of this pandemic, Gauteng, still on the lead. Let's take a look at how far the COVID numbers have grown in just 7 days. More than 160,000 people are positive in Gauteng. More than 90,000 people are positive in the Western Cape province. More than 75,000 people are positive in the Eastern Cape, and more than 68,000 people are positive in the province of KwaZulu-Natal. This week, the World Health Organization Director General Dr. Tedros spoke about the importance of taking precautionary measures and always staying informed about the COVID pandemic. Let's listen to Dr. Tedros.
We're asking everyone to treat the decisions about where they go, what they do, and who they meet with as life and death decisions, because they are. It may not be your life, but your choices could be the difference between life and death for someone you love, or for a complete stranger. In recent weeks, we have seen outbreaks associated with nightclubs and other social gatherings, even in places where transmission had been suppressed. We must remember that most people are still susceptible to this virus. As long as it's circulating, everyone is at risk. It's all about making good choices. Know your situation. Do you know how many cases were reported where you live yesterday? Do you know where to find that information? Do you know how to minimize your exposure? Are you being careful to keep at least 1 meter from others? Are you still cleaning your hands regularly? Are you following the advice of your local authorities? Don't expect someone else to keep you safe. We all have a part to play in protecting ourselves and one another.
As we approach the peak of this pandemic, we remind you that it is still mandatory to wear a cloth mask that covers your nose and mouth whenever you leave your homes. Also, regularly wash your hands with soap and water and use sanitizers with 70% alcohol content. Clean and sanitize all surfaces in all public spaces, and most importantly, always keep a safe distance of at least 2 meters from other people. Well, if you believe there's a chance you may be infected with the virus, call ahead to seek medical help from your healthcare provider or use the public hotline 0800 029 999 and alert them to your symptoms. Thank you so much, and back to you, Peter.
Thank you so much indeed, Zama. Yeah, now, as you know, with things like statistics, you've got to remember that as we observe and report on the COVID-19 numbers, these can change, and sometimes significantly, as you've been seeing in our daily updates on our news channel. Welcome back. You're still watching Health Talk. Now, according to a global burden of disease study in 2016, deaths caused by viral hepatitis surpassed all chronic infectious disease, including HIV and AIDS, malaria and tuberculosis. Local data suggests that in South Africa, an estimated 3.4 million people are infected with hepatitis B and at least 400,000 with hepatitis C. Health Talk senior producer Zama Buthelezi spoke to an Eastern Cape resident who has lived with hepatitis for 30 years.
Tiara, thank you so much for talking to us. Tell me, when did you find out you had hepatitis?
I was first diagnosed in 1989 with hepatitis B. Then I found out per accident, it was an accidental thing because hepatitis C is very asymptomatical. In 2010, I found out. I've subsequently done treatment and here I am.
Talk to me about the symptoms that you presented before you were diagnosed.
With hepatitis B and hepatitis A, you do tend to go very yellow. Obviously, hepatitis D as well. Hepatitis C is very asymptomatical. I lived with it for like 30 years prior to diagnosis. So it is absolutely imperative that we get our entire population tested.
Did the treatment work? Were there any side effects?
Well, I actually accessed my own treatment because it wasn't really available in South Africa at this stage. After my first month, I was already showing undetected. I'm now 3 years post-treatment, and I've now still reached my sustained viral response, which is absolutely it's awesome.
Talk to me about the level of awareness in the country. Do you think enough is being done to educate people about this pandemic?
Definitely not. I'm under the liver clinic, the infectious diseases here in Port Elizabeth. And the amount of patients that we have is so scary, and it's hepatitis B, and there's people coming from rural areas, and especially for birth doses as well of Hep B vaccination. It's not available. There's nobody out there going into rural areas. And of course, now with COVID, it's presented an even larger problem for us. It's a great challenge.
You started the foundation. Are you getting assistance from the Department of Health and also Social Development, because you decided to take the first step into assisting communities?
I'm not at the moment, no. I'm not at the moment. This is all just self-done and via social media, and I go out into townships and what have you.
Tiara, Thank you so much for the interview. We look forward to having you again in the near future to raise awareness and educate our viewers about this pandemic.
Thank you very much for having us. Thank you very much for having me, and blessings and a happy Hepatitis Day to everybody.
Thank you.
All right, so viral hepatitis, this is a public health threat worldwide, but it's of particular importance in South Africa due to the country's high prevalence of HIV, because co-infection can accelerate the progression of both diseases. Since 2011, together with national government, civil society and partners with the WHO, has organised annual World Hepatitis Day campaigns as one of its 9 flagship annual health campaigns to increase awareness and understanding of viral hepatitis. Viral hepatitis is a public health threat worldwide, but it's of particular importance in South Africa, and this is due to the country's high prevalence of HIV, because co-infection can accelerate the progression of both diseases. Since 2011, together with national government, civil society and partners, the World Health Organization has organized annual World Hepatitis Day campaigns as one of its 9 flagship annual health campaigns to increase awareness and understanding of viral hepatitis. South Africa has released new national viral hepatitis guidelines, and to talk to us a little bit more about these, we're now joined by Dr. Khomotso Vilakazi-Nhlapo, who's the medical coordinator, TB, HIV integration and viral hepatitis at the National Department of Health. Thanks so much indeed for joining us, and welcome to the program.
Good morning, Peter, and good morning to the viewers. Thank you for having me.
All right, so hepatitis seems to be an enormous problem. And when I look at the theme of World Hepatitis Day this year is the missing millions. So we literally have many people in South Africa walking around with a form of hepatitis but don't know.
It is true, Peter, mainly because viral hepatitis is mainly asymptomatic. Most of the people who are infected are not aware that they are infected. With hepatitis B, the infection usually happens when you are younger. And most of those who get it before the age of 1, like 90% of those babies, will develop chronic hepatitis B infection. And with children between the ages of 1 to 5, it's about 30 to 50% who can develop chronic hepatitis B infection. And with adults, it's about 5 to 10%. If you get infected as an adult, you will develop chronic hepatitis B infection. The younger children, when they are adults, about 20, 30 years later, they will only find out then that they were actually infected with hepatitis B or C. And usually they have complications at that time. They may be presenting with cirrhosis, liver failure, or even liver cancer.
All right, so you've mentioned some of the outcomes of prolonged hepatitis. Perhaps let's just start it again at the beginning and in simple terms, try and explain to our viewers, what is hepatitis? We keep hearing hepatitis B, C, we even have D, alcoholic hepatitis, so many terms. Try and make it as simple as you can for us so that we can understand what we're dealing with.
Hepatitis means inflammation or swelling of the liver, and it has many causes. It can be caused by drugs, even the medicines that we take for some of the diseases we have, like TB, can cause hepatitis, or even ARVs, toxins like poisons, alcohol, as we just said, and viral infections like viral hepatitis can be caused by hepatitis A, B, C, D, or E, or it can also be inflamed due to other parasites or other bacteria, or you can even have an inflamed liver or a swollen liver from physical damage if you are assaulted or if you are involved in an accident. For the purposes of this talk, we are talking about viral hepatitis, which means there's a specific virus that is causing your liver to inflame or swell or become larger than normal. Viral hepatitis A and E are usually transmitted through orophycal. Orophycal means through the mouth or feces, like what you eat and even sanitation. Hepatitis B and C is through blood-to-blood transactions, and through sexual transmission, can be through mother to child transmission, like a pregnant woman who's infected with hepatitis B, and to a lower level, C, can transmit the infection to the baby. To have hepatitis D, you have to have hepatitis B, because D is not a full virus. So it needs the envelope of hepatitis B to be able to infect you.
And other ways of getting this, it could be sexually transmitted and also drug users and syringes, isn't it?
Yes. With the hepatitis C, it's very common in people who inject drugs, even healthcare workers through needle stick injuries. You can get it from blood transfusions. Fortunately, in our country, since 1992, we do check for hepatitis B and hepatitis C, including HIV. You can also get hepatitis C from tattoos, especially if the tattoo parlor that you go to doesn't practice infection control measures, that is, uses unsterile equipment. Wow. You can get it from body piercing, manicures, household items like toothbrushes, razor, nail clipper, especially if the person who used that instrument before is infected with the virus. You can also get it from scarification, like that is traditional practices. You know, in some of our cultures, we do have like scarifications where we use razor blades, and you find that they use one razor for many people. If one of those people is infected, they can transfer infection to other people.
All right, let's talk a little bit about management of hepatitis, treatment. I know there's a vaccine for one of the strains.
Okay, hepatitis B has a vaccine. That is why we've got the, in our immunization schedule for children, API, we've got vaccination for the babies at 6 weeks, at 10 weeks, at 14 weeks. We also have a booster at 18 months. This is because, as I said earlier, the younger you are, the higher are the chances of developing chronic infection as an adult. So we give them the vaccine at those ages, and we also give it to healthcare workers because they are also at risk, because they are exposed to patients and blood or bodily fluids that may be contaminated by blood. We also recommend that newborns should be given a hepatitis B vaccination within 24 hours of birth, because once they live for the 6 weeks until the first immunization at 6 weeks, they are vulnerable. You know what happens when you get a baby. Everybody comes to see the baby, and we do not know. As I said, this condition is mainly asymptomatic. People may be infected and you don't know, and they can infect the baby. And unfortunately, most babies don't become symptomatic, so we won't even know that the baby is actually infected. Hepatitis B is not curable, but fortunately, it is manageable, just like HIV. So should you be found to be positive with hepatitis B, you can be assessed by a doctor, and then there is treatment, that is tenofovir. Tenofovir is the same drug that we actually use for HIV. So it also helps control hepatitis B. We also screen mothers. As I said, the younger babies are at high risk of getting the infection. We screen mothers for hepatitis B, If we find that they are infected from 28 weeks of pregnancy, we give them tenofovir to prevent mother-to-child transmission of hepatitis B. With hepatitis C, we do not have a vaccine. It is also asymptomatic like a hepatitis B. So if you are found to be infected, there is a treatment called direct-acting antivirals. Unfortunately, the medicines are not yet registered with a regulatory drug authority in the country. But there is a way of accessing those treatments. I'm sure Prof. Wendy Spearman will give you further information about the process. But those drugs have been shown to cure hepatitis C in more than 90% of the people who are given the treatment.
All right. Dr. Kgomoso Vilakazi-Nhlapo, we're going to have to leave it there, but thanks very, very much indeed for those important insights regarding viral hepatitis. Thanks so much for your time.
Thank you for having me.
All right, so that was the Medical Coordinator, TB, HIV Integration and Viral Hepatitis at the National Department of Health, Dr. Kgomoso Vilakazi-Nhlapo. And just to let you know, the vaccine program started in 1995 in South Africa. So if you were born before then, before the vaccines came out, you probably want to go and get yourself checked out. So if you're born before 1995, go and get yourself checked out for hepatitis B. We'll be back with more after this break. Stay with us. We'll be chatting to the head of the liver clinic at the Groote Schuur Hospital. She's also the head of department at the hepatology at the University of Cape Town and hepatitis. And she'll be talking to us about the impact of COVID-19 has on the disease. Welcome back. You're still watching Health Talk. Now, globally, more than 250 million people are living with chronic hepatitis B infection. Infants are especially vulnerable. About 90% of children are infected with Hep B in their first year of becoming chronic Hep B carriers. Hep B attacks the liver and claims the lives of nearly 900,000 people each year. And to talk to us a little bit more about clinical management of patients with hepatitis, we're now joined by Professor Wendy Spearman, who's the head of the liver clinic in Groote Schuur Hospital and head of department of hepatology at the University of Cape Town. Thank you so much for joining us, Professor Spearman. Welcome to the program.
Thank you for inviting me.
So, Prof, who is most vulnerable to contracting hepatitis?
So I think we need to look at terms of when we're looking at hepatitis B or hepatitis C. One of the big problems about hepatitis B is that you can acquire it from mother to child. So you can acquire it during delivery, or more importantly in South Africa, probably under the age of 5 from other infected siblings or playmates. So when we're addressing the problem of hepatitis B, we need to look at mother-to-child transmission, looking at children under the age of 5, and then obviously importantly in high-risk groups, so healthcare workers, importantly injecting drug users. Those are all high-risk individuals who may be at risk of acquiring hepatitis B if they haven't received the appropriate preventative vaccinations. In terms of hepatitis C, that really isn't. The risk of acquiring that from mother to child is much less unless the mother is HIV co-infected. Sexual transmission also is much less except in HIV co-infected. So here this is significantly associated in the past with unsafe blood transfusions, unsafe injection practices, and now increasingly amongst our population, the injecting drug users, they are high-risk populations.
How infectious is hepatitis?
So hepatitis B is extremely infectious. Really just require micro droplets. It's a very robust virus, remains viable for several days outside the body. So really is something that one needs to be addressing very actively in South Africa in terms of our preventative measures, remembering that hepatitis B vaccines, hepatitis B, but importantly, the complications of cirrhosis, and very importantly, the risk of liver cancer, which is associated with hepatitis B. Unfortunately, for hepatitis C, there is no vaccine, but as you know, both for hepatitis B, we have treatment that can virally suppress the virus and have very good long-term outcomes. And now for hepatitis C, we have curative therapy and that can be taken for 8 to 12 weeks, depending on the type of virus, the genotype, and depending whether the patient has advanced fibrosis or cirrhosis.
So what we're finding out is that you can be asymptomatic for a very long time. Does this suggest that as a matter of course, we should be going and checking and testing for hepatitis periodically just to make sure that we're not infected and get treated early?
I think that's a very important concern, is that most people underestimate the prevalence and the burden of disease associated with hepatitis B and C, because in fact, in most situations, if it's acquired, it's usually completely asymptomatic until you develop the complications, and that's typically for hepatitis B. Hepatitis C, people often complain of very mild, well, not necessarily mild, but non-specific symptoms such as fatigue, just not coping as well, and they're picked up on screening, say if they actually present to blood transfusion services to donate blood, and that's how they might be picked up. So I think in terms of our hepatitis B, we need to really be actively implementing our guidelines that were published in December 2019, where we're now advocating that mothers are actually screened, pregnant women are actually screened for hepatitis B surface antigen. They're then considered for the appropriate prophylaxis. So this would, if you were very viremic, so it had a very high viral load for hepatitis B, at 28 weeks you would start an antiviral, and then importantly, the baby at the time of delivery would be given the birth dose vaccine. That was then followed up by 3 doses of vaccine at 6, 10, and 14 weeks, with the boost at 18 weeks, and that's 18 months, sorry. And that is part of our EPI schedule now. The birth dose vaccine has not as yet been actively implemented, but we hope that's going to be coming into practice quite shortly. So I think in terms of healthcare workers, that's very important that they should be screened for hepatitis B surface antigen. And if they are not immune, have never been exposed before, they should be actively vaccinated. And we should be addressing all high-risk groups. Hepatitis C, there are really sort of 2 cohorts. Those who were born sort of pre-mid-90s, blood transfusions, we couldn't, and blood products, we actually couldn't screen for hepatitis C. Also, our sterilization techniques in theaters, surgical practices was not as good as they were now. So those individuals are potentially at risk of having acquired hepatitis C. And then I think now, once again, healthcare workers, high-risk groups such as injecting drug users, we need to be looking at actually establishing whether these individuals are infected. And importantly, in high-risk individuals, we have the risk of onward transmission. Very important to identify them, get them onto treatment, so not only do you cure them, but also prevent onward transmission of hepatitis C.
All right, so if you can assist us as well, kind of explaining the vulnerability of people perhaps who also have HIV and also this COVID-19 environment, what hepatitis B does as perhaps a complication.
So HIV, if you're co-infected with HIV and hepatitis B or HIV and hepatitis C, this follows a much more aggressive natural course. So you're more likely to develop the complications of cirrhosis and liver cancer much earlier, tends to be more aggressive. The important thing about HIV hepatitis B co-infection is that our antiretrovirals include both lamivudine and tenofovir, which are highly effective against hepatitis B. So if you are co-infected with HIV, even if you're not screened for hepatitis B, you are going to be receiving the appropriate therapy. One of the problems is actually individuals who are hepatitis B monoinfected, actually identifying them and getting them onto treatment. Importantly, the tenofovir, which is the first-line therapy for hepatitis B, is part of our essential medicine list, so everybody does have access to it. HIV and hepatitis C co-infection, once again, more aggressive disease, but what is really important in the era now of direct-acting antiviral therapy, there's no difference in the response rate in terms of whether you achieve a cure, whether you're hepatitis C mono-infected or HIV and hepatitis C co-infected. So that's very important. That's been a real major breakthrough with the new DAA therapies, whereas previously the response, if you were HIV and hepatitis C co-infected to our interferon-based therapy, was actually poor. And importantly, in fact, now with DAA therapy for hepatitis C, there are really no difficult to treat infected groups, which is really quite an amazing achievement. In terms of COVID-19, I think it's important to realize that if you have hepatitis B or hepatitis C, you are stable, you're on therapy, on maintenance therapy for hepatitis B, or you recently have started treatment for hepatitis C, there's actually no evidence that you are more susceptible to COVID-19 or that your outcomes will be worse. The problems really come if you're already cirrhotic. And there does certainly seem that those individuals, if they actually acquire COVID-19 and have severe disease, that their mortality is higher than the normal mortality reported at about 20%. So we're looking at about a 34% 30-day mortality. So once you're cirrhotic, then the outcomes of COVID-19, if you are chronically infected with hepatitis B and C, are worse. I think importantly, it's very important that if you're on treatment, that you should continue the treatment. You should not be stopping the treatment because you've acquired COVID-19. In terms of initiating treatment for hepatitis B, if you're COVID positive, no contraindication to that. For hepatitis C, one can actually wait until you've actually have recovered from COVID-19, but certainly if you're on treatment, should not stop treatment. And then I think the important thing to remember in individuals who are hepatitis B positive, but not yet on treatment, who might be getting immunomodulatory treatment for COVID-19, there is the risk potentially of these individuals reactivating. So those individuals should start on treatment, even if in their own right they don't need treatment as yet for hepatitis B. The other thing is that what we've noted is that cirrhotics who present for the first time with the first episode of decompensation, so they become confused or they now have become jaundice or they've developed abdominal swelling, it's important to realize that these individuals might have COVID-19 and might not have the usual symptoms of COVID-19. So it's important for any cirrhotic who presents with a deterioration to consider the diagnosis of COVID-19 and to screen them.
All right, so a lot of people are probably listening to this and they're thinking, my goodness, there's so much to deal with and I'm scared. Is there anything that we can do generally to be more preventative of getting hepatitis?
So I think in terms of hepatitis B, I think we need to know where are the potential sort of day-to-day risks of actually acquiring hepatitis B or hepatitis C for that matter, but particularly hepatitis B, which is highly infectious. So importantly, one needs to think about, they're often needle stick injuries. So really, if you're an injecting drug user, we need to be actually actively embarking on safe needle syringe exchange programs, opiate substitution programs. Importantly, other risk factors are things like tattoos, sharing of personal hygiene equipment such as nail clippers, going to the barber. Those are sort of day-to-day things where you actually can acquire hepatitis B. So one needs to be actually very careful about that. And then I think, we live in a country where hepatitis B is endemic. I think we should know our status for hepatitis B. And if we are non-immune, we need to be actually vaccinated. Remembering that the vaccination for hepatitis B was introduced in April 1995. This has had a significant effect in decreasing our prevalence of hepatitis B in South Africa. So I think if you're born pre-95, then definitely one should consider knowing what one's hepatitis B surface antigen status is and actively embarking on vaccination.
How often should we check for hepatitis? Is it, once a year, once every 2 years? What's a good marker? So
I think for hepatitis B, we really need a once-off check whether you actually have the virus with the hepatitis B surface antigen test. And then once you're vaccinated, importantly, that's 3 injections, of course, the 3 injections, you really will have lifelong immunity. So there's really no need to recheck unless you are at a high risk in terms of potentially your partner has hepatitis B, then you might want to, or you're a healthcare worker where there's a high risk of acquiring hepatitis B, then it's potentially, if depending on what your titers are, so you would like considered immune if you have a titer greater than 10, if you're in a high-risk group greater than 100, and then it's probably worthwhile to check a year after actually being vaccinated what your titers are. If your titers are above 1,000, that's excellent, and then you probably only need to recheck about 5 years later. But the rechecking would really be in high-risk groups where you want to maintain a good surface antibody protective titer. For hepatitis C, importantly, and I think people need to realize that, although the treatment is curative, usually 8 to 12 weeks of therapy, the problem is you can become reinfected. And that's really very important in our high-risk groups, that we actually practice harm reductions programs, have them actively implemented within communities, because you can become reinfected, unfortunately. And there's no vaccine at present for hepatitis C.
All right. Professor Wendy Spearman, we're going to have to leave it there. Thank you so much indeed for that valuable information, and let's hope our viewers have taken it all into account and start to take the right steps. Thank you so much indeed for talking to us.
Thank you very much.
All right, that's Professor Wendy Spearman, who's the head of liver clinic at Groote Schuur Hospital and head of department at hepatology at the University of Cape Town. After the break, we speak to a sports physician about exercise, the immune system, and the importance of exercise, especially during COVID-19.
I usually talk to people who saved on their car insurance, but today I'm talking to all of you who haven't. Because if you call Outsurance and they can't quote you less than what you're currently paying, now you can ask them to give you 500 Rand. And if you've been with the same insurer and been claim-free for the past 3 years, tell them to make it a massive 1,500 Rand. Savings or cash, you always get something out. SMS card to 44211 or call 08600 60,000 for a quote.
You pay less at Clicks with great health savings. Buy Sinutab nasal spray $54.99 each. Save 20% on selected Vital products. And save 20% on Tib, Septiguard, Flu Relief products. Clicks. Feel good. Pay less. Are you on chronic medication? Sign up for our repeat prescription service and receive a monthly SMS reminder when your pre-packed medication is ready for collection. Get your meds your way.
Welcome back. Thanks for tuning in and watching Health Talk. The COVID-19 pandemic means that many of us are staying at home and are sitting down more than we usually do. At a time like this, it's very important for people of all ages and abilities to be as active as possible. This is according to biokineticist and media personality Letseho Zulu. She explains how regular exercise can be beneficiary to you, particularly during this pandemic.
Some people with breathing problems avoid physical activity because it makes them feel short of breath. But avoiding physical activity might reduce your lung function even more. That is according to biokineticist Letseho Zulu.
So exercise is good for weight management. It's also absolutely important for reducing your risk of chronic disease. It's important for reducing stress. And, you know, more positively, exercise is good for increasing or improving your heart health, increasing energy levels, improving your brain health and memory. So there are lots and lots of reasons why everyone should be, you know, up and about and exercising.
As we are in the midst of COVID-19, very little is known thus far. But what is known is that COVID-19 comes with the most dangerous symptoms, which is shortness of breath. You would be pleased to know that there are exercises that can help with your breathing problems.
Probably a good 90% of us don't actually breathe properly. We tend to, breathe using our chest muscles instead of our diaphragm, which sits literally just below the lungs and above above your belly button. So if you can do belly breathing exercises and something as simple as a balloon. If you have balloons at home, blow balloons with your kids, or even if you don't have kids around, just have some balloons around and blow it as big as possible. Let the air out and do that a couple of times throughout the day.
Before participating in any physical activity to help with your breathing, it is important to first consult with your doctor.
We are all different, and different exercises are best for different people. So it is best for you to just run your exercise program past your doctor because they know your health history.
Show us some of the 3 or 2 exercises that people at home can do or to improve their breathing out.
Any exercise that gets your heart pumping will definitely improve your breathing capacity. Another exercise where you put your hands on the couch and you can just bring your knee to your chest and straighten it out again, bring the other knee, or you can go in a running motion. We call that mountain climbers. And I mean, that's also just a simple exercise that you can do in the house. You can even do push-ups on your couch. So you can see I'm not even leaving the couch. I'm basically showing you that there is really no excuse for people not to be exercising because you can do things in your own house. So you do push-ups, you put your hands on your couch and you just basically bend your elbows down, bring your chest close to the couch and straighten your arms again. So yes, there is a lot that one can do in your own home. I exercised in my living room just this morning. So I did a 30-minute routine. If you've got a skipping rope, then skip, So there is a lot that one can do in your own living space. And there are a lot of apps as well that are free that you can download and utilize them as well for exercising in your home.
All right, so now we shift our focus on this segment to take an in-depth look at exercise during the time of COVID-19. And we're speaking to a sports physician, Dr. Mamusilo Dichaba, who's a lecturer at the Wits University, and she'll be using scientific evidence to answer how exercise may affect the immune system against COVID-19 and how to maximize the benefits of exercise during this time. Dr. Dichaba, thanks so much indeed for joining us. Welcome to the program.
Thank you for inviting me, Peter.
All right, so there is science, I guess, that supports the idea that exercise can assist the immune system.
Yes, that is irrefutable. It has always been known that exercise does benefit the immune system. However, you have to look at what type of exercise and how. If you look at the literature in all articles, you'll realize that the exercise immune system chart follows a bar, whereby if you look at the left side of the bar, there is no exercise at all, and the immune system is very low. So no exercise or little exercise corresponds to very few or little immune system benefit. Then as you go into the middle, where you have most of your moderate intensity exercise, that is where your biggest benefit for the immune system will be. So moderate intensity exercise, it should also be regular, so the benefit. If you look at the far end of the graph, you realize that the benefits that you get from exercise start tapering. So as you get to the very high intensity exercises, you find that it becomes deleterious and it becomes too aggressive to the body, and your immune system competence goes down. So the best way to maintain your immune system is to have regular, moderate intensity exercise. Then you'll have optimized your immune system.
So how do you know when you start going to the area of this is too much? I think too little we probably know because our bellies start growing and things like this. But how do we know when we've crossed the line to this is no longer within moderate?
I think maybe let's take one step back and say that the first principle for exercising is proper assessment and proper evaluation. So I want to encourage people that before they start exercising, unless they are regular exercisers and they know exactly where they are and how to do things, they should always contact their healthcare worker, who will then do a proper assessment of them and of their health status, and then recommend to them how to start and where to go. If you haven't exercised before and you are not a regular exerciser and you are not fit, you should always start low, because you need to introduce the body. You don't want to shock your body. You need to introduce the body gradually so that the body can adapt. We usually recommend about 2 weeks in the initial stages, and then you should increase gradually until you get to your optimum level. The other trick is that you should always listen to your body.
Yeah. All right, it looks like we might be losing Dr. Dichaba, but let's just see. Again, I think the warning really is exercise is good, but make sure that it's in that moderate range. And if you haven't exercised before, then start off slowly and build up your strength and your energy and get to those moderate levels, but don't go too far. Dr. Dichaba, thanks so much indeed for coming back. So breathing is one of the issues that keeps coming up with COVID-19, and I suppose increasing our capacity for our lungs and ability to breathe is a good weapon against COVID-19.
Maybe, Peter, before we get there, let's just say a warning. When you look at a respiratory disease of any kind or any systemic disease that affects the lungs, you first have to look at two things. Are you in the chronic state or are you in the acute state? Please, people should not exercise if they are in the acute state of the disease. The reason is, if you look at most of these acute illnesses that affect the respiratory system, COVID being one of them as well, they are from viruses. Now, the problem with viruses is that at the time that you are acutely ill, you have a very high viral load, meaning that there are too many viruses in the body that are trying to attack the body. One of the parts of the body that the viruses enjoys a lot are your muscles. And one of the most important muscles in the body is your heart. So these flu-type viruses, they love your muscles and they love your heart muscles. So if you are going to exercise, you have to make sure you've gone through the acute phase and you have recovered. Please do not exercise while you are ill with a respiratory tract illness, especially if it's of an infectious nature, especially if it is viral, because you run the risk of that virus then attacking your heart muscles. And because your heart is now under stress because it's working so much for you to exercise, then your heart will get sick. And unfortunately, it may just be a short-lived illness that you recover from, but we have seen a lot of patients succumb to cardiomyopathy secondary to viral myocarditis.
All right, and that's why I suppose not even just COVID-19, often you hear people saying don't exercise when you've got flu.
Yes, you shouldn't exercise. That is why, if you remember, if I go back to my first point, I said, please consult your healthcare worker. Your healthcare worker will be able to assess, and then your healthcare worker will be able to give you guidelines as to how safe it is to exercise, at what level, to what extent. The other problem with COVID is that sometimes people don't even know that they are sick, or they do not know the extent of their illness. What happens with COVID is that it creates a condition called hypoxia. What it means is that the oxygen level or the oxygen saturation that is in the blood of people is low, but they are not yet as distressed to the level that their oxygen is low. So there seems to be a mismatch between the level of oxygen that is running in the blood relative to how breathless the person is. So you may have minimum breathlessness, very little, and think that, oh no, maybe this is not serious, I can still do a little bit of this, but only find that the status of your body is much worse than that. So if anybody is not feeling well, it doesn't have to be a major illness. As long as you wake up, sometimes with COVID, COVID, you don't even have the typical flu-like symptoms. You are not even breathless. You just feel tired. If you feel that you are not your usual self and you feel funny, you don't feel like you usually do, please take the precautions and go and consult your healthcare worker. COVID seems to pick a lot of symptoms that we were not expecting at the beginning. At the moment, I'm seeing a lot of patients that just have a headache, and that's all they present with. They just have a headache. And under normal circumstances, you just say, maybe I didn't sleep well. You'll always find a reason for the headache. You pop 2 Panados and you think you are good to go. Please do not do that. Do not self-medicate. If you're not feeling well, if you feel feeling a little bit unwell, not sure what it is, please consult your healthcare worker before you can exercise. The dangers of exercising when you are not feeling well far outweigh the benefits that we always attribute to exercising.
All right, Dr. Mamsilo Dichaba, we'll leave it there. Thank you so much indeed for those very important pointers and warnings as well about exercise and particularly around COVID-19. Thanks so much for your time.
Thank you for the invite.
All right, that's Dr. Mamsilo Dichaba, sports physician, saying that it's very, very important, to exercise, but get into the moderate range. Don't overdo it. Build up your strength if you've not been exercising. And if you feel less than yourself, err on the side of caution. Don't exercise. Listen to your body. Your body will tell you what you need to know. Now, after the break, we'll be speaking to a clinical psychologist about post-traumatic stress disorder, otherwise known as PTSD, and how to cope during COVID-19. Stay with us. Welcome back. This is Health Talk. Now, COVID-19 pandemic can exacerbate existing mental health conditions and cause new stress-related symptoms. Some people have acquired SARS-CoV-2, which causes COVID-19, and may go on to develop a severe illness that requires hospitalization. This experience may cause trauma for them and for anyone close to them. Others may even experience trauma from the environment that the COVID-19 pandemic has created, such as not being able to see their loved ones, having feelings of isolation, and also experiencing disruption to daily lives and routines. To talk to us a little bit about post-traumatic stress disorder and COVID-19, we're now joined by clinical psychologist Cassandra Govender. Thanks so much for joining us. Welcome to the program.
Yes, thanks for having me.
All right, so COVID-19, I think one of the things that I've noticed, a lot of people build some anxiety just hearing the COVID-19 updates every single day and seeing the increase in the number of infections and deaths.
Yeah, for sure. So I think one of the biggest challenges at the moment, obviously, is all the information we're currently exposed to. We're hearing things not just from news channels, from friends, from WhatsApp groups. I think it's a bit overwhelming to always be bombarded and reminded about all of this.
So we're talking about PTSD, and, you know, I've always sort of associated it with post-war kind of scenarios and very extreme trauma. Can it exist in less traumatic but situations that do affect us quite significantly?
For sure. So I think the thing about post-traumatic stress disorder is it occurs after you have experienced or even witnessed an event or an experience in your life that is considered traumatic for you. So I think one of the most commonly held misconceptions is it's only really for extreme violence or extreme trauma, but trauma has a unique way of interacting with all of us in different ways. So, for example, you can develop PTSD after you've had a particularly difficult divorce. You can develop it with stress at work. So I think those are some of the things people don't realize.
So how does one start to kind of recognize that maybe I've got PTSD and I need some support?
Well, I think the first step is that after you've had a traumatic event or something stressful in your life that is continuous, it's important to start to note changes and differences. So not everyone who's experienced something traumatic will go on to develop PTSD, and the way it's expressed in our bodies can look very differently. So if you find that perhaps you've got some physical shifts and physical symptoms that are accompanied with perhaps extreme fear, wanting to avoid certain situations, having nightmares, having flashbacks of the incident. Those are some of the things to look out for developing PTSD. Now, the interesting thing here, or one of the things to keep in mind, is that post-traumatic stress disorder, as it is named, indicates that the trauma is past. So I think that currently with COVID-19, we have a lot of there's a lot of vulnerability to people developing PTSD, but I'm not sure how many of them would start to develop it right now or a little bit further along as we go, because the trauma and the stress hasn't passed yet.
So could it be that there's people who perhaps have worked their way through PTSD, end up in a scenario where, because of COVID-19, they get triggered again?
For sure. So I think there's different elements of this COVID-19 that can trigger people in order to experiencing PTSD. The event itself of a pandemic is ongoing, so it might likely set up that you have more increased anxiety, but specific events within it are what might contribute to the development, not just the event itself. And that's having a family member pass away from COVID-19, having yourself testing positive and perhaps experiencing some stigma, worrying about how people are going to, or your community is going to react to you being diagnosed with COVID-19 or finding out about it. So I think it's those kind of events that can then perhaps trigger this experience.
What kind of people or situations are you finding most common that are coming to you these days in the middle of COVID-19?
I think people are having a very acute stress reaction. So I'm not seeing necessarily a lot of clinical PTSD, but a lot of grief, a lot of stress, and a lot of worry. I think people are worried financially. So there is a lot of socio-economic implications in people's stress levels at the moment, and that's manifesting in physical ways. So we have people with a lot of physical bodily symptoms where they're having headaches, chest pains, backaches, body pains that are not necessarily medical in nature. Those have increased, and people's just worry and overall concern and desperation around the time, but also fear about contracting the disease, so not wanting to go out, which is understandable, but really struggling or having a difficult time even to go to the shops to buy groceries. And just, overall concern and worry about themselves, their families, and I guess the world at the moment.
And I guess, and you mentioned it just now, funerals are not the same as they were. There's kind of ways that we're used to sending people off, and this has all changed. The numbers are down, and also access to the body. All of that, I guess, is piling even more stress on people.
Well, I think during this time, it's made it very difficult for us to grieve as we normally do, amongst other things that we're used to and the ways that we live normally. But I think with grief specifically, it's sad, it's shocking, it's difficult when someone has passed away from COVID or something else during this time, and you're unable to even go to your family like you normally would and gather together in remembrance, never mind just the actual funeral. There's a number of rituals that are not being able to be observed the way it normally would be. But also there's the fear of, if I do go to this restricted funeral, there's still a chance I might contract it at the funeral. So it's still a stressful time, when you're trying to process something big that's happened in your life.
All right, so what can we do at home if we see someone that looks like perhaps they're taking strain and possibly showing some symptoms of PTSD? What can we do?
Well, I think that we should look out not just for PTSD symptoms, because I think we're about to hit a wave of PTSD or it's coming or starting to come, but also to look for signs before that. So not wait for people to present with disorders before we start noticing things are changing. So when we're finding people in our life are maybe isolating or are eating too much, eating too little, are starting to talk quite negatively or express that they're really struggling during this time, or you find that they're not talking at all, but you can see that they're not as motivated. So working from home has been a big challenge during this time, and productivity is starting to decline. Perhaps you see that they're struggling to get to the laptop on time, or they're not doing any kind of activities, things like that. Really changes in behavior that are not explained by the changes we've been forced into, but maybe exacerbated in a way that makes you concerned. And I think your first step is to actually have a conversation, to talk to your friends, your family, check in. How are you doing? How are you feeling? How are you experiencing this time? Do you need support? I think we shouldn't be afraid to talk to each other and connect during this time, because it's our biggest ally.
Cassandra Govender, it's been a pleasure talking to you. Thanks so much indeed for talking us through this difficult subject. Thanks for your time.
You're welcome. Thanks for having me.
All right, that's clinical psychologist Cassandra Govender. So please do take note of what's happening to yourself and people around you, and get help as soon as you can. Thank you so much, everybody, for joining us and watching this week's edition of Health Talk. Don't forget, the only way to manage this pandemic is if we all play safe and protect each other. Stay at home, social distance, wash your hands and wear masks outdoors. I'm Peter Ndora. Till next week, take care.